Welcome to Loving Pets channel. In this video, we talk about adrenal disease ferret treatment and drugs to avoid. Several human medications are currently employed in the treatment of adrenal gland disease, as well as secondary prostate enlargement, estrogen-induced anemia, thrombocytopenia, and mammary gland hyperplasia. While these medications are effective, they can be quite costly. Leuprolide acetate, marketed as Leuprolide, is an injectable medication that inhibits luteinizing hormone, LH, production, thereby reducing stimulation of the adrenal glands. Leuprolide is available in 3 formulations: a monthly injection, a tri-monthly injection, and a quarterly injection. The recommended dosage ranges from 100 to 500 micrograms per kilogram, administered monthly. Finasteride, available as Propecia or Proscar, is an oral tablet indicated for the treatment of enlarged prostates in male adrenal ferrets. This medication functions as an enzyme inhibitor, effectively reducing the formation of dihydrotestosterone, DHT, the primary hormone responsible for prostate enlargement. As DHT levels decrease, the prostate will gradually shrink. The initial recommended dosage is 1 mg daily for the first 30 days, after which the dosage can typically be reduced to 0.1 mg daily. Bicalutamide, known as Casodex, is another oral option for managing enlarged prostates in male adrenal ferrets. This medication works by blocking androgen, DHT, receptors in the prostate, leading to a gradual reduction in prostate size. However, it is important to note that bicalutamide does not lower DHT levels. The suggested dosage is 5 mg daily. Anastrozole, commonly known by its brand name Arimidex, is an oral medication utilized in the treatment of estrogen-induced anemia, thrombocytopenia, and mammary gland hyperplasia. As an aromatase inhibitor, anastrozole effectively reduces estrogen production in the body. By lowering estrogen levels, it facilitates the bone marrow's ability to resume the production of red blood cells and platelets. The recommended dosage is 0.1 mg per kilogram, administered once daily. Epoetin alfa, marketed under the brand names Epoetin and Procrit, is an injectable medication that can be used in conjunction with Arimidex to address estrogen-induced anemia. Following the reduction of estrogen levels through the use of Arimidex and/or Leuprolide, Epoetin alfa can stimulate the bone marrow to enhance red blood cell production. The initial recommended dosage is between 100 to 200 units per kilogram, administered 3 times a week, with a gradual tapering of the dosage as the packed cell volume normalizes. In summary, while these medications provide effective treatment options for adrenal gland disease and related conditions, together, these therapies can effectively manage the complications associated with estrogen-induced anemia, promoting improved hematological health in affected patients. It is essential to consult with a veterinarian to determine the most appropriate treatment plan tailored to the individual needs of the ferret. Next, we talk about drugs that should not be used in the treatment of adrenal disease ferrets. Midotane, marketed as Leuprolide, is the primary medication utilized for treating adrenal gland disorders in dogs, particularly Cushing's syndrome. It is important to note that adrenal gland issues in dogs differ significantly from those in ferrets. In dogs, the condition is characterized by an overproduction of cortisol, while ferrets experience an excess of hormones and androgens. In dogs, adrenocorticotropic hormone stimulates the adrenal glands, whereas in ferrets, luteinizing hormone serves this function. Leuprolide functions by destroying the cortisol-producing cells within the adrenal glands. However, it is ineffective in ferrets and may lead to severe hypoglycemia, particularly in those with concurrent insulinomas. Another medication, ketoconazole, commonly known as Nizoral, is also employed in the treatment of adrenal disorders in dogs. This drug acts as an enzyme inhibitor, effectively reducing levels of cortisol and androgens. However, similar to Leuprolide, ketoconazole does not yield favorable results in ferrets. Trilostane, sold under the brand name Vitaril, is another option for managing adrenal disease in dogs. Unfortunately, this medication has been shown to elevate levels of 17-hydroxyprogesterone in dogs, a hormone that is commonly elevated in ferrets suffering from adrenal gland disease. Consequently, the use of trilostane in ferrets is likely to exacerbate their adrenal conditions. Preliminary studies conducted in the Netherlands have corroborated this concern. Tamoxifen, known as Nolvadex in human medicine, is a widely used anti-estrogen that functions by blocking estrogen receptors. However, research involving ferrets has indicated that Nolvadex may exhibit estrogen-like effects in this species, potentially worsening conditions such as estrogen-induced anemia, thrombocytopenia, and mammary gland hyperplasia. In summary, while several medications are available for treating adrenal gland disorders in dogs, they lack efficacy and safety in ferrets. We suggest consulting with a veterinarian to determine the most appropriate treatment plan tailored to the individual needs of your ferret. Thank you for watching. If you enjoyed the video, don't forget to like, comment, and subscribe. It really helps out the channel. Got thoughts or questions? Drop them below. I'd love to hear from you. See you in the next one.